Health Topics Tuesday on the weekday wake up at SVI Media, and today I'm with Dr. Niki Mileson with Star Valley Health. Well, Dr. Mileson, let's talk about COVID-19. Of course, adjustments being made by businesses all over the country, including right here in Lincoln County, and telehealth visits are becoming more common with Star Valley Health.
Correct. It's actually a service that's been provided by the state of Wyoming for a while through the Wyoming Telehealth Network. We just have not been able to use that as much. It's used a little bit more on the eastern side of the state, but now with some of the laws loosened, we've been able to institute telehealth visits and policy, and all of our clinics, our urgent cares are set up for telehealth, and that's through a program called Zoom meetings. And I've done several of them and gone really well, been able to see my own patients and new patients and evaluate for respiratory symptoms, and it's actually working out quite well.
Again, with Dr. Niki Mileson with Star Valley Health on our Health Topics Tuesday. Dr. Mileson, let's talk a little more directly specific to COVID-19 and the screening testing process. We've heard a lot about testing, but not really a lot about the specific process of getting tested. Walk us through what happens if someone were to get tested for COVID-19.
Testing is a sore subject around the country, unfortunately. Testing is not yet widely available. It's especially sparse in rural communities. We do have testing capabilities at Star Valley Health. Unfortunately, like I said, nationwide testing is shorthanded. They are trying to ramp that up. But unfortunately, at this second in time, we do have to conserve our resources. And so testing is reserved for patients that are quite sick and need to be hospitalized. And also, we're prioritizing for our healthcare workers who are trying to keep the community safe and healthy. And right now, those are the biggest groups that we're testing. There are potential for testing a few other groups, but it's really by a case-to-case basis, and it has to be approved through a physician, and they need to be evaluated before that testing is accessed.
And Dr. Mileson, if someone thinks they may have symptoms of COVID-19, there is a hotline set up through Star Valley Health for them to call so they're not just walking directly into the ER and potentially spreading that.
You're correct. We do ask that all patients, if they want to be evaluated or if they're having symptoms of what they are worried about might be COVID-19, there's a couple different access points to help those individuals out. The biggest one that we've put into circulation is our live hotline. That is available 7 a.m. to 7 p.m. The number for that is 307-885-5008, and that would get the person connected with a nurse that would take them through screening questions. If you're a patient of any of the family medicine clinics, you can also have that screening done through the clinic, and a lot of times access your primary care physician through a telehealth visit to be evaluated. The other option, if you're not a patient or if your doctor is busy, we do have the urgent care in Alpine and in Afton, and those clinics can be contacted to have appropriate evaluations done. Again, they are also doing telehealth visits. Right now it is available 7 a.m. to 7 p.m., but please look at our website at starvalleyhealth.org for future announcements and good COVID-19 information. We're hoping to be able to keep that open 24/7 soon.
Dr. Niki Mileson, while we have you, one more question. There's been a lot of chatter, if you will, on social media about the ability to transfer patients to larger hospitals if needed, and whether or not hospitals are accepting patients from smaller hospitals. Help us separate fact from fiction. If somebody needs to go to a larger facility for treatment, is that available?
It is available, Duke. I have heard those rumors as well. We've talked to our main referral hospitals, and they have assured us that, unfortunately I have to hedge and say, assuming that they're not overwhelmed and that they have the space, they're working the same as we are and trying to stay ahead of this, that they are accepting transfers from Star Valley Health.
Dr. Niki Mileson with us today for Health Topics Tuesday. Dr. Mileson, thank you so much for your time. Anything else?
I think that's it. Thanks a lot, Duke.
All right, you bet. Thank you very much.